So today I want to talk about what does gallstones and kidney stones have in common, okay? First of all, a gallstone is a cholesterol stone. A kidney stone is more of a calcium stone. So that's definitely what they don't have in common, okay? What happens with gallstones is you get this super saturated cholesterol particle that builds up because you are lacking bile. Bile normally is supposed to break up things and keep your cholesterol from binding and forming stones. If you have a gallstone, we know you have low bile. And there's even tests that can be done to measure the ratio of your cholesterol to your bile. So your cholesterol to bile ratio, just to see what that's at. So the lower the bile, the more concentrated the cholesterol, the more the gallstone. Now the kidney stone, there's several different kinds. This is the most common one right here, calcium oxalates, and it binds, and it has these really jagged edges that can create a lot of pain and discomfort and bleeding in your kidney, and also the pressure that builds up because it's obstructing the urine flow. This is what they both have in common. If you look at the condition Crohn's, which is a malabsorption problem of your intestines, you nearly always have low amounts of bile production. Now, that's probably because the last part of your small intestine is damaged, and that's where you're supposed to absorb and recycle bile. 95% of all your bile gets absorbed at the last part of the small intestine before it goes into the large intestine and gets sucked back and recycled. If your intestine is damaged, you're not going to recycle that, so you're going to be deficient in bile. And what's interesting about Crohn's and different types of malabsorption problems is that there is a high risk of not just gallstones, but kidney stones as well. And here's some extra data that you need to know. Bile binds with calcium and oxalates. So if you have enough bile, it can help you decrease the risk of building up this calcium and oxalates in the kidneys, because it will decrease the amount of calcium and oxalates that's present in your urine. And so there's a bile connection, a bile deficiency in both gallstones and kidney stones. If we take it one step further, we look at fiber. Fiber also can decrease the risk of kidney stones because it binds with calcium and oxalates. So one thing you need to know is that a good amount of vegetable in your diet will help you. Also, vegetables contain magnesium, which will also decrease the risk of kidney stones. And they're a good source of potassium, which also can help reduce the risk of kidney stones. And another point about kidney stones is that if you're at risk, it's very, very vital that you consume over 2.5 liters of fluid every single day. That will keep things diluted enough where these calcium oxalates can't form. Now, your microbiome, bacteria make bile salts as well. So your liver makes the primary bile salts. They come down, and your microbes take those primary bile salts, strip off a few things, little proteins and things like that, and then turn them into secondary bile salts. So the microbes are involved. If there's a problem with microbes, let's say you had an antibiotic, for example, or a series of antibiotics, and you don't have enough microbiome, you could also become deficient in bile, thereby increasing your risk of kidney stones and gallstones. So it's not a really simple thing. You have to understand the whole picture. You have to make sure you have some fiber, fluids, your microbiome. You want to make sure that you take care of your intestines. And if you're developing a gallstone or a kidney stone, it wouldn't hurt to start taking purified bile salts to help to start binding these calcium and oxalates, as well as to break up some of this cholesterol. All right, thanks for watching.
Hey, we're back.
With another amazing recipe.
No grains, no sugar, totally keto. There's no suffering in keto.
Absolutely not, Karen.
And it's an immune system builder.
Absolutely, you have to check this out.
I think you should hurry up, watch the recipe, and make it yourself. It's just so easy to be keto.
But is it simple?
It's super simple. We hope you enjoy making it as much as we are enjoying eating it.